How to lose chest fat for males. Man boobs. Do you want to lose fat around your chest? Do you know what causes chest fat in men? Well, don't worry. You will get the answer to all your questions in this video. So what causes chest fat or man boobs? And why is it so common in males? A bad diet and lack of exercise may be the reason for chest fat in most males. However, in some cases, an underlying medical condition might be causing chest fat. Excess fat deposits on your chest can be caused by simple genetics. Sometimes excess chest fat in males is caused by low testosterone levels called gynecomastia. This results in a benign swelling of your breast tissue. One study estimated that 30% of men would experience gynecomastia in their lifetime. The most common points of life to exercise gynecomastia are infancy, puberty, and between 50 and 80. Certain medications can cause gynecomastia as a side effect. These include antibiotics, anti-anxiety medications, steroids, antidepressants, ulcer medication, cancer treatments. Well, targeting chest fat can be challenging, but with targeted exercise, a diet plan, and a little bit of patience, it's possible to get rid of stubborn fat deposits on your chest. So, how do you get rid of chest fat or man boobs? To get rid of excess chest fat, you must understand how fat loss works overall. Unfortunately, there's no way to target chest fat without dropping fat from the rest of your body. The Forbes equation states that for you to lose 1 pound of fat, you need to burn 3,500 calories. Since most people consume between 1,800 and 3,000 calories per day, the goal should be to operate at a slight calorie deficit each day. So for example, you should try using between 500 to 800 more calories per day than you consume. At a 500 calorie deficit each day, you would be able to lose 1 pound per week theoretically. If you kept it up, you could lose 10 pounds in 10 weeks. People with the most success at losing weight and keeping it off lose weight slowly but steadily and adopt a healthy lifestyle instead of crash diets. So, how to create a caloric deficiency? Reducing your intake of fat and carbohydrates is one practical way to create a caloric deficit. Weight training, in combination with high-intensity cardio, is another effective way to make calorie deficiency. Tracking your calories using an app or a notebook is an excellent way to figure out your average daily calorie intake. In addition, an app or website can tell you how many calories are in many different foods to help you track that. Let's start with the weight-burning exercises for the chest. Push-ups. The classic push-up is a great way to start targeting your chest and upper body. Start in plank position, with your arms outstretched underneath the rest of your body and your feet shoulder-width apart. Slowly lower yourself to the ground, keeping your arms as close to your body as possible as you near the floor. Press upward to raise your body back to your starting position. Repeat as many times as you can and try to increase the number of push-ups you do in each set each time you practice this exercise. Cable cross. The cable cross exercise helps tone the muscle around your chest area and underneath your arms. Start by setting the pulleys above your head. Set the weight resistance low at first and aim to do as many reps as you can. Standing with your back to the machine, with your hips square, slowly draw both pulleys towards you. If you can, bring them all the way forward until your arms cross into an X shape. Repeat as many times as you can, gradually increasing the amount of weight as you grow more comfortable. Bench press. When you start bench pressing weight, start at a lower weight and have someone spot you to make sure you don't drop the bar and injure yourself. Start by lying with your back flat on the bench and the bar at eye level above you. Grab the bar at shoulder width. Pull your shoulder blades together and arc your back before you try lifting the bar. Lift the bar gently off the rack. Take a deep breath before you lower the bar down to your chest, keeping your elbows at a 45-degree angle as the bar comes down. Once the bar touches your body, slowly lift it back up. Dumbbell pullover. This exercise is done while laying flat on the workout bench. Holding a dumbbell so that one of the sides of the weight faces you, keep it straight over your chest at arm's length. It's best to hold it by the opposite side of the weight, with your thumbs wrapped around the bar, to keep the weight from falling on top of you. Slowly lower the dumbbell back over your head and toward the floor. Try to keep your arms straight the entire time you're lowering the dumbbell. When you first attempt this exercise, make sure to use a low-weight dumbbell so that you can get a feel of what you're doing. Ideally, Have someone spot you while you do this exercise to ensure that the dumbbell is being held securely and correctly. Cardio. Regular cardio exercise will help you burn calories and blast fat throughout your body. Cardio for weight loss options include stair stepper, elliptical, running outside at a moderate pace, jumping rope, biking. Try to do 20 to 40 minutes of cardio per day, at least 4 times per week, for best results. Losing fat from your chest area may seem complicated, but the right combination of diet, activity, and exercise can make it possible. If you're concerned about your weight or your appearance makes you self-conscious, speak to a doctor. They can give you advice according to your stage of life. If you like our video, press the like button and hit subscribe button. Check out our other videos on how to lose fat and get six-pack abs. See you at our next video.